Diagnosis according to Zhangfu organ patterns, damp heat in the liver. When there is damp heat in the liver, there are signs and symptoms of a generalized damp heat condition, as well as specific liver symptoms and signs. It is important to note that damp heat in the liver can be a relatively serious condition. It is often seen when the liver in Western medicine physiology is not able to break down and excrete bilirubin as it should. Symptoms of damp heat in the liver can indicate that there has been a significant reduction in the liver function due to some form of liver failure. Excessive consumption of food and medicine that are hot in their energy or produce dampness is the etiology of damp heat in the liver. Emotional imbalances that weaken the spleen or stagnate liver qi and thereby generate heat in the liver. This could be worries and speculation that bind and thereby weaken spleen qi or unresolved emotions, frustration, repressed anger, irritation, and so on that stagnate liver qi. Exogenous dampness can invade the liver channel in the legs and be transmitted via the channel to the liver organ. There can also be direct invasions of exogenous damp heat, especially in tropical climates. The condition can also arise when there is latent heat from an unresolved pathogen in the liver. This can lead to chronic conditions such as hepatitis in Western medicine. Symptoms and signs: fever or aversion to heat, chest oppression, costal tension or pain, hypochondriac tension, sense of heaviness and fatigue in the body, yellow skin color and yellowish sclera, red and suppurating skin diseases, rashes and sores, itching, burning, or stinging skin, sores or rashes, genital sores or sores around the mouth, copious, odorous, yellow, sticky vaginal discharge, swollen or red and painful genitals, irregular menstrual bleeding, spotting, yellow, sticky sweat, bitter taste or sticky sensation in the mouth, dark and scanty urine. The urine may be odorous, burning urination, poor appetite, nausea, thirst with no desire to drink, red tongue with even redder sides, greasy yellow tongue coating, rapid, slippery, and or wiry pulse in the left quant position. These symptoms: feelings of heaviness and fatigue, bitter or sticky taste, nausea, yellow skin and sclera, dark urine, and yellow greasy tongue coating. Treatment principle: drain damp heat from the liver. Acupuncture points we choose from liver 2, 5, 8, 14, bladder 18, 22, GB 34, 41, SJ5, spleen 6, and 2, 9. Little technique is draining. Liver 2, 14, GB 34, and bladder 18 drain damp heat from the liver. Liver 5 and 8 drain damp heat from the lower jaw, especially the genitals. GB 41 and Sanjiao 5 open thigh and drain damp heat. Bladder 22, spleen 6, and 29 drain damp heat. When there is damp heat in the liver, the person should avoid consuming substances that create heat or dampness, especially if these substances have an affinity with the liver. Alcohol, hot spices, fried food, and too much red meat should be avoided. Foods such as dairy products, sugar, sweets, nuts, bananas, and other damp-producing foods should be also avoided. A liver that is burdened by medication, alcohol poisoning, and so on will have difficulty metabolizing chemicals. Therefore, caution should be exercised in the consumption of all kinds of medicine, including dietary supplements and herbal remedies. Stress and pent-up emotions, especially anger and frustration, create heat in the liver. It is therefore important to address these emotions when possible. Physical activities such as sport and fitness, Tai Chi, Yoga, or Qigong will be beneficial because it will help to disperse stagnant liver qi, which is often involved in the creation of damp heat in the liver. Damp heat in the liver can be caused by spleen qi deficiency, damp heat, liver qi stagnation, heat, invasions of pathogenic qi, and can result in liver fire, phlegm, liver blood stagnation. To summarize, etiology of damp heat in the liver includes irregular diet and lifestyle, excessive consumption of greasy foods, excessive anger, climatic damp heat. Underlying accompanying pathology, spleen Qi deficiency with dampness, stagnation of liver Qi. Signs and symptoms, fullness in the hypochondrium, bitter taste, nausea, poor appetite, heaviness of the body, yellow vaginal discharge, vaginal itching, genital rashes, mid-cycle bleeding or pain, redness and swelling of the scrotum, difficult burning and painful urination, pulse, slippery, wiry, rapid, tongue red with redder sides, sticky yellow coating. Treatment principle, coarse liver and clear damp heat, transform damp in the middle burner. Acupuncture treatment. Bladder 18 dispels hepatocystic damp heat. Liver 14 calms the liver and disinhibits Qi. GB 24 courses the gallbladder, transforms damp heat. Sanjiao 6 with GB34 relieves pain in the lower ribs. Spleen 9 moves central burner and transforms damp heat. Liver 3 courses liver Qi, needle with drainage. Thank you for your attention.